Many thanks for staying with us. Talking health now, the fight against malaria reaches a milestone as shipments of the world's first WHO-recommended malaria vaccine, RTS-S, have begun, signaling a significant leap in malaria control efforts across Africa. 331,200 doses arrived in Yaoundé, Cameroon, with additional doses set for Burkina Faso, Liberia, Niger, and Sierra Leone in the coming weeks. This marks the beginning of scaling up vaccination against the deadly disease. In 2021, malaria claimed 619,000 lives, with 77% of deaths among children under 5, mostly in Africa. The introduction of this vaccine aims to turn the tide. The RTS-S vaccine administered in Ghana, Kenya, and Malawi resulted in a 13% drop in all-cause mortality in children. Other findings show high vaccine uptake and no reduction in other malaria prevention methods. Additionally, the WHO's recommendation of a second malaria vaccine, R21, further strengthens hopes for combating the disease. Both vaccines are expected to meet high demand in African countries. The arrival of these vaccines is lauded as a game changer in the fight against malaria, aiming to save thousands of lives each year, as several countries who are now in the final stage of preparations for malaria vaccine introduction into routine immunization programs expect delivery of vaccines, which should see first doses administered in early 2024. Joining us on the news is Dr. Zakari Usman, Honourable Commissioner for Health, Kogi State. Dr. Zakari Usman, it's nice to have you around.
Thank you. It's my pleasure being around. Thanks for having me.
Of course, it's a pleasure. According to the report, additional African countries are in the final stage of preparations for malaria vaccine introduction into routine immunization program against next year. Is Nigeria one of those? And what is required in terms of preparation for the receipt of the vaccines?
Yeah, thank you so much for this. First of all, yes, Nigeria is one of the countries that have been penciled down for the next round of the vaccines. And preparations has already been ongoing in earnest. One of them is that, first of all, from the learnings from the effectiveness of these vaccines in other countries, there's demonstration that, that's the way to go. Preparation has to be with sensitizing the people, getting healthcare professionals, to be sensitized, giving an orientation to healthcare caregivers, the general public, because we have, generally, Nigeria has a lot of issues with vaccine acceptance. But with the demonstrable, prevention that has already, we've seen about 13% drop in the countries that have been that have these vaccines piloted, and because of that, Nigeria, stands to benefit a whole lot, contributing a large chunk to the disease burden in Nigeria. And the preparation has to be with, engagement at the 3 levels: the national and the subnational level, including the local government levels. Preparation for, the logistics and, the supply chain in terms of warehousing, providing the appropriate warehousing facilities, providing appropriate logistics to the last mile where these vaccines will be distributed. And the good thing is that, we're talking about integrating this into routine, immunization. We're talking about integrating this into routine primary healthcare delivery services, including community services. So I think, a lot of work is going on at the national level. There's a lot of sensitization going on at the subnational level. No other preparation than, the orientation, the capacity to house these vaccines, and then having people trained on the administration of this vaccine. As for the efficacy, it's been demonstrated already.
Okay, Dr. Usman, you said that efforts are ongoing, and we know that there have been some measures way before now to curb the spread of malaria. But then, despite these efforts, we see that there's still some level of prevalence And we see that happening to some group of people and, of course, in some certain regions in Nigeria. So why do we have this prevalence on these high rates of malaria infection in some other areas in Nigeria than others?
That's what is described as the malaria belt. Nigeria is it's a malaria endemic country, countrywide. And even beyond that, there are some Sahel region that where there's proliferation of any part of the country where, especially the Sahel region where mosquito breed without any form of breed effortlessly. Those are the areas where malaria transmission is widespread. And you talked about a particular group of people. Yes, there are people who are, susceptible to the severe forms of this malaria, and those people are the people that are targeted. We have children less than 5 years. We have pregnant women. We have people who have immunosuppression from any form of disease, HIV, diabetes, whatever form. Those are people who come down with severe forms of this malaria. But beyond that, there are riverine areas. There are areas that support the growth and development of mosquitoes, which carries the malaria parasite, and those are the areas that are targeted mostly. You talked about prevalence. Yes, there's a retinue of preventive measures, prescribed by WHO, which includes the insecticide-treated nets, indoor residual spraying, intermittent, preventive therapy for pregnant women, anti-malaria, treatment of malaria cases, and all of that. And one of the reasons why, despite this effort, there's still a prevalence is if it's not, you can't be very sure that, cohesively every part of the country does all of this, because one preventive effort is not enough. Okay. That's why it has to be a combination of all of this. And recently, in some parts of the country, about 18 states, 18 northern states, yes, they are piloting what they call seasonal malaria chemoprevention, also together with the insecticide-treated nets and all the other preventive measures. And we're beginning to see results, and I think that, takes us it helps us to accentuate the prevention message. It also helps us to, achieve a lot more with prevention of malaria, with the addition of the seasonal malaria chemoprevention.
Yes, we now see that there are proactive measures in place to deal with this particular scourge as it spreads, not only in Nigeria, but across Africa. And now we are expecting vaccines to come in for the administering to those who have been infected. I'd like to find out from you, Dr. Usman, does Nigeria have the capacity to also produce vaccines like this? Do top African countries also have the capacity, the funds, or maybe the facility to equally produce vaccines like this to accelerate the process of distribution and administering of these drugs or antidotes, as the case may be, to those who are infected? Because we're looking at how to curb the spread and reduce the number of those, or to reduce the contagion, as it were. Does Africa or Nigeria have that capacity?
Well, I wouldn't be very definitive. I think in my response to that would be conceptual. And that is that, with, deliberate effort and determination, yes, Nigeria does not lack the technical competence to do that. Nigeria does not lack, the willpower to do that. All that is required is the political will, which has been demonstrated already by the president of the country, President Bola Ahmed Tinubu, who has gone all out to demonstrate that the political will is there. What it takes is the domestication of this technology. What it takes is to encourage research. What it takes is to allow people to be creative. And I think Nigeria and some other African countries have the capacity to do this going forward. And I wouldn't be deliberate as to whether that can happen now, but what I am sure of is the technical capacity is not lacking in Nigeria. The can-do spirit is not lacking, and we already have a president who has demonstrated the political will to encourage indigenous research in these areas. And I think, yes, it's an interesting area to look forward to, and I think I'm also very positive that Nigeria can key into this.
Okay, to wrap things up, Dr. Usman, while we await the malaria vaccine, what other individual or community or probably government efforts would be apt or in terms of the deployments now towards malaria prevention and control? Also, I'd like to also shed a little bit of light on the seasonal malaria chemotherapy.
Okay, like I said earlier, the WHO is a multi-pronged approach, prescribed by the World Health Organization. And this has gone on for so long. The introduction of the malaria vaccine is just an addition with the ongoing seasonal malaria combo prevention. Talking about, personal, group, or organizational, or a state or a country-wide approach. What I mentioned earlier, the insecticidal treated net, where we talk about the long-lasting insecticidal net. Some of them are, fabricated, pre-impregnated with insecticidal, chemicals. That helps to prevent malaria. We also have the indoor residual spraying, where we use insecticides and all of that. Netting of the houses can also, whether with not necessarily using insecticidal treated net, but the regular netting to prevent the vectors from getting into the houses. We also have intermittent preventive therapy that we give to pregnant women. There is the environmental management, which includes clearing of stagnant waters, clearing of the bush around the houses, giving anti-malaria to treat malaria cases, to prevent transmission through mosquito bite from one person or the other, effective case management. And of course, you just mentioned the seasonal malaria prevention, which is, targeting children between the ages of 3 to 59 months, yes, and is basically about the provision of, sulfadoxine, pyrimethamine, and amodiaquine combination. We call it SPAC. It's an initiative that started. 21 states of the Federation are involved. My state, Kogi State, is one of the states that's benefiting from the SMC. Started in 2021.
Okay.
And basically, the target, I can be very specific about my state. The target for 2023 in my state is to reach about 1.2 million children aged 3 to 59 months. In the last 3 years, about 2.8 million children have had, this chemo prevention. And this has actually helped in reducing, the prevalence of malaria and the severity of malaria cases in this particular age group.
All right, Dr. Zakari Usman, Honourable Commissioner for Health, Kogi State. It was nice having the discussion with you. We appreciate that.
Thank you so much. Nice being here.